So welcome everyone. Can everybody hear me? Welcome to the Healthy Ulster Council January 2021 meeting. I just want to say that we're going to give a couple seconds to let everybody join us. We've got about half of the people that should be here. And we've got a great schedule today. We have some very pertinent news on the Housing Action Study and an update on the opioid epidemic and the response to it. And we'll also get a little update from the health department on the vaccine rollout. We have some time for networking, and I'm just expecting to have a really robust meeting today. So I just want to introduce you to our hosts. Let me just move there we go. So today I can introduce myself. I am Melinda Herzog. I'm the Healthy Communities Program Leader at Cornell Cooperative Extension of Ulster County, and I do coordinate the Healthy Ulster Council on behalf of the Ulster County Department of Health and Mental Health. Also with us is Stacy Kraft. And Stacy, you just want to introduce yourself?
Yes, hi, good afternoon. Stacy Kraft with the Ulster County Department of Health, Public Health Education Coordinator. And I've been working at the pods doing some volunteer coordination and also at the Recovery Services Center answering phone calls and involved in our social media pages and more. So thank you.
And also with us as a co-host is Katie Sheehan Lopez. Katie, can you introduce yourself?
Yes, hi, my name is Katie Sheehan Lopez, and I'm the SNAP-Ed Nutrition Educator at Cornell Cooperative Extension.
Thank you. Move us along here. Having trouble moving my PowerPoint ahead for some reason. There we go. So, welcoming you all, I just want to go over a little bit about Zoom. I think everybody's probably an expert by now, but I don't want to just assume that. Just a few things that you can take a look at. That would be that your audio is down here on the left, and you can also adjust your video. I want to let everyone know that the meeting is being recorded, so you can choose to have your video on or off. Participants, you can, of course, give thumbs up if you want. There are those possibilities. We're going to be using the chat box a lot today. I'm going to ask everyone to stay on silent for the time being. When we get to the networking session, you'll be able to take off of your, unmute yourself, so to speak, and you'll be able to network a little bit. So you can also change up here on the upper right how you view everyone, and you'll be able to see how, whether you're looking at just the speaker or everyone in the room. So these are all good things to know. And here's some of our housekeeping rules. I'd like everyone that's here to type your name and your organization in the chat box. That's one way we get attendance. And it also introduces yourself to everyone in the room, and they know exactly where you're from, because sometimes your little box underneath you and how you've identified yourself doesn't always share your organization. So this way they know where you're from, and it's one way to network. Please do stay muted through the presentation, and if you have questions during the presentations, please ask them in the chat box. At the end of the presentation, your questions will be read aloud and we will get answers. We're going to have a lot of people here today. We already have 32 participants, and I'm expecting more, so it will be really hard for everyone to try to talk at once. So the chat box is going to be our friend today. Today we have, like I said, on our agenda, we have Evelyn Wright from, she's the Deputy County Executive of Ulster County. She'll be presenting on updates from the Ulster County Housing Action Plan Study. We also have a presentation from Vin Martello, our Director of Community Health Relations at Ulster County Department of Health and Mental Health, and the Director of the Opioid Prevention Strategy for the Ulster County Executive's Office. He'll be sharing an update on the opioid epidemic and response. And then we're going to take a stretch break. We're planning on altering the agenda just a little bit. I had this wonderful office yoga prepared for all you guys, and I know you're excited about it. But we thought that in lieu of current events, we would give the health department a chance to update us a little bit on the vaccine rollout. So we're going to take 5 minutes or so there to get some information on how things are going. And then we have our facilitated networking session, which we can use to share a name or organization and one event or program. We have, less than a minute a person, so we're going to do that really quick, and we'll have rules to share about that when the time comes up. But it's really important to stick around for that because you learn so much about everyone's organization and everything that's going on in the county and what things you should know about. So I want to introduce Evelyn Wright, one of our deputy county executives, and she's going to be presenting on updates from the Ulster County Housing Action Plan study. So let me just stop sharing so that Evelyn can share. And we'll give her a minute to kind of get her presentation up. And I'm going to mute myself.
Thanks, Melinda. Delighted to be here. I really appreciate the invitation. It's great to see everybody. Can you see the slides? All right, great. So yeah, I'm here to present some updates from the Ulster County Housing Action Plan study. I'll tell you a little bit about the study process. We are reviewing drafts and working through it now, so I'm hoping we're going to be releasing it probably this time next month. But I can tell you a little bit about what we've learned from the data that we're looking at, and what we're kind of strategy reflections that we have drawn based on what we're seeing, and hope to have some time for some feedback from you all. So the goals of the study have been, first of all, to really provide comprehensive data on housing issues in Ulster County and how they vary across the county. So all of the data you'll see today, we've done at both the county level and the municipal level, and there will be detailed municipal snapshots of all the data within the report, and so that municipalities can use that when they're looking at their own individual situations. Another goal is to broaden our understanding of the factors that are influencing housing affordability in the county at this time. And we identified pretty early on that we really have just a critical shortage of housing in the county, and so really look for strategies to increase that housing supply. And last but not least, or really foremost, to start a community-wide conversation about how we can work together to address our housing crisis, because it really is going to take all of us working together to do that. So we've been working on this study since June, with Pattern for Progress leading the effort for us, and with the great service of our Ulster County Housing Advisory Committee. So we've got 9 folks from all over the county housing landscape who have been meeting monthly with us and with Pattern, reviewing the data, sharing perspectives, and going through a fair amount of community outreach. So we really want to appreciate all of them for the service that they've provided. Some of the key insights from the data that we're seeing, and I'll go through a little data on each of these. First of all, Ulster County's population is aging. I'm sure that doesn't come as a surprise to most of you. Incomes are stagnant or declining throughout the county, except among the highest income earners. It was a little surprising to me just how stark that is. And meanwhile, while incomes are declining, both housing prices and rents continue to rise. So it's really putting the squeeze on our population. We'll look at some measures of affordability and unaffordability, and we find that nearly 1/3 of homeowners and more than half of renters are living in either unaffordable or really, really unaffordable homes. So it's a very large fraction of our community that is faced with a housing cost burden. And of course, COVID has only exacerbated these trends. So the data I'm going to show you here are mostly through 2018, which is the most recent data that we have available. But COVID has made all of these things worse. So first, just a little look at our population pyramid. So between the 2010 census and 2018 census data, you'll see an increase in the green bars for the older than 55 population, and a decrease in them for the younger population. So our population is gradually aging, and the percentage of the population that is over 55 years is slowly growing. And of course, the relevance of that to housing is that many folks may be finding that the home they're in is not appropriate for them as they're aging, or needs some changes as they're aging. And we don't have a great supply of senior housing in this county. And that's one of the things that we really need to address in order to be able to enable our population to continue living in their communities. As I mentioned, that we're seeing both on the renter side and the homeowner side that incomes are down while home prices are up. So among renters, inflation-adjusted annual incomes are down 13%, while on an inflation-adjusted basis, rents are up just a little bit. And again, this is through 2018. So we're expecting that when we have updated data, we're going to see a much starker increase in rents, certainly in some, if not all, parts of the county. For homeowners, the decrease in income is a little bit less stark, but the increase in home prices is higher. And again, this has continued to go up since 2018. And when we look at those changes in income across income quintile means, so if we divide up incomes into 5 bins, you can see that the lower your income was in 2010, the more it's gone down since then. And it's only those earners in the highest income levels that have seen an increase in their income. If we take a look at what are our largest employment sectors, we see that in many of those sectors, incomes are too low or way too low to carry housing costs. So our largest sector is government. It has a higher average wage than some of the sectors, around $60,000. But if we look at some of our other top sectors, healthcare, retail, accommodations, and food services, these wages are too low to cover most housing costs in the county. So when we start talking about what is affordable and what is unaffordable, a rule of thumb is that affordable is when 30% or less of household income is spent on housing costs, and that includes both rent or mortgage payments as well as home insurance and home maintenance and utilities. So when those are less than 30% of the household income, we call that affordable. When it's greater than 30%, we call that unaffordable. And when it's greater than 50%, they call that severely cost burdened. So when you're spending more than 50% of your income on your housing costs, that's the point where the household is really vulnerable to any car repair, health emergency, any kind of outside the budget surprise can just tip the household over into crisis at that point when you're at the severely cost burden level. So when we look at our population by renter versus homeowner versus combined, we see that more than a third of our total population is living in homes that are either unaffordable or severely cost burdened. So about 37.5% is unaffordable. A slightly better situation for the homeowners, who are at about 14% severely cost burdened and 17% unaffordable. But when we move to renters, more than 50% of them are either severely cost burdened or unaffordable, and almost 30% are in that very vulnerable to disruption category. When we take that same information and segment it by race, we see that race heavily skews this data, and of course there's a relationship there between home ownership versus renter and race that's playing a role in this. So we can see that about 2/3 of white non-Hispanic households are in that affordable category, but 37% of Black households are in that affordable category, and now well over 60% are in the cost burdened and severely cost burdened, and over 50% for Hispanic households. One way that Pattern likes to break down how to think about this is to just think about what wage someone would have to earn to be able to afford an apartment at what HUD calls the fair market rent, which is HUD's assessment of what a market rent is. And so again, that was, as of, I think this is 2018 data, $1,155 a month for a 2-bedroom apartment. At that 30% threshold, that would be affordable at $22 an hour. But the average wage of our renter population is closer to $13 an hour. And that means on that wage, you could afford a much lower rent. Another way to state that is earning $13 an hour, you would need to work 67 hours a week to be able to afford that fair market rent. And all the data I've been showing you so far is for Ulster County as a whole. When we look at each of these things across the county, we see very different patterns and issues. So if we look at, there's an interplay between household income and housing cost here. If we look at how median household income is distributed across the county, and what we get for those severely cost-burdened households, again, those households that are spending more than half of their income on housing, you can see that some of our lowest household income households, municipalities, are in that severe cost burden category. So, for example, the village of New Paltz, where we have a lot of college students, so low median household incomes, and also in the village of Saugerties, you can see over here that those are two of the municipalities that have high levels of severely cost burdened households. But on the other hand, another community with high levels of severe cost burden is Gardner, which has a relatively high median household income. So you see the interplay there between the role of income and the role of housing costs in what creates an unaffordable situation for residents. And of course, COVID has only exacerbated these trends. So we've seen unemployment take off. We see huge numbers of households that are now in very precarious income situations. We've taken a look at some housing market data for 2020. Inventories are down and housing prices are continuing to rise. So COVID is just making this a more extreme situation. So having taken a look at this data, and I have to say I was dismayed that the data shows that things are even worse than I would have guessed that they are. We then took a look at, okay, what are the drivers of this situation? What is causing this? There's a whole set of causes in the labor market and the structures of our economy, which we've really been working through our Department of Economic Development and Employment and Training with in the Ulster 2040 plan. But sticking today on the housing cost side, some of the drivers there are first of all, we just have a very low inventory of homes that doesn't match demand. Kathy Germain from RUPCO let us know that they have dozens of folks who are holding housing vouchers and cannot find apartments. So they're able to pay their rent, but they simply cannot find an apartment to rent. And that's true on the home sale side as well. And part of that is because we have seen very little new construction in recent years, except on the very high end of the market. So we're just not matching the homes that we're building to demand. And Judge Ika from Pattern for Progress calls this the missing middle, where we're not building in the middle end of our housing demand. So it's not just a lack of low-income housing, it's really all across the spectrum except for the very high end. A part of that is driven by a high cost of development, that costs of land are going up, costs of labor are going up, costs of raw material are going up, infrastructure costs and infrastructure limits. We also have, in many places, a lengthy and sometimes very uncertain approval process. And the larger a project, the more difficult it can be to get it through the approval process. And we have found that a lot of projects face community opposition to one degree, which can contribute to that lengthy and uncertain approval process. So when we start looking at what can we do about this, these are some of the strategies that we've been looking at. And first of all, I alluded to this at the beginning, we really need to engage the entire community on the importance of housing and how critical it is, not just to our neighbors' well-being, but to the health of our community as a whole and to our economy. We have a large employer on the Housing Advisory Committee that said, you know, this is an economic development issue. I am constrained in my ability to hire because my employees can't find housing. And I hear the same thing from SUNY New Paltz and other large employers, that it's really an issue in attracting employees and especially in retaining employees if they can't live here. So we're going to find this a constraint on our economy. And I know many of you in the health world are very clear on the role that housing insecurity plays in people's health challenges and the way it increases our communal costs of health care as a result. So I think the number one strategy that we have is that we really need to have a community conversation about how important this is, and make sure that when we're talking about building new housing, the voices who are in favor of building it are as strong as the voices who may say, well, I'm not sure I want this down the street from me. And it's been a fairly one-sided conversation in many instances so far. And the county, I think, can play a role in helping municipalities identify what are the practices that they can take on at the municipal level that will encourage an increase in housing supply, given this backdrop of community demand for more housing. And so we're working through in the report a series of strategies that municipalities can take a look at and say, is this appropriate for us? So there are zoning changes that can be made, there are regulatory changes that can be made, there are taxing changes that can be made to stimulate an increase in the supply of housing. A further step that municipalities can take is to proactively identify sites in the community for development. So rather than waiting for a project to be proposed and having a conversation about, I don't want it here, to start from, we know we need to build more housing, where would be good for us to do that? And we can proactively identify and even pre-approve sites, go out to find a developer with a request for qualifications or a request for proposals to stimulate development in the place where we think it belongs. The other thing that is a strategy that's being pursued a lot in other places is to look for opportunities for what they call scattered site redevelopment. So rather than one big project, where can I find a neighborhood where I have either vacant lots, homes that need rehabilitation? It's not possible for a developer to package those sites into one project to apply for federal low-income housing tax credits and be able to assemble a project of sufficient scale to be able to use those tax credits for. Now that's a complex project. The developers that we've talked to who are doing this work are all nonprofit housing developers because it really is a labor of love. But we saw a very cool project up in Schenectady where they're rehabilitating one of the most troubled neighborhoods in Schenectady through a combination of infill and rehab. I mentioned the approval process. There are things that municipalities can do to streamline that approval process, let developers know upfront what's required to get approval for a project of different types in the community. And so far we've been talking largely about family housing, but the other thing that we need to do, and I know this is really close to the hearts of many of you in the health community, is increase the supply of supportive and transitional housing. So transitional housing that's supporting people in moving from homelessness back to being housed, and supportive housing for folks that may be recovering from addiction, dealing with mental health issues, or physical disability issues that need ongoing supportive services. And we don't have enough of that kind of housing in the community as well. So I'll stop there, and I'm interested in taking your questions, of course, but also hearing your feedback on what we've found and on these strategies if we have time.
So I just want to remind everyone to put your questions in the chat. And Evelyn, I guess I have a question. I just wondered how long you've been working on this study.
Yeah, so we started in, I want to say in June, so it's been about a 6-month process.
Okay. And what happens to the report? It basically heads out on websites, but is it directed to anybody in particular, realtors, or where does it go?
Yeah, I think, you know, this, as I said, is very much intended as a community conversation. So we're making plans to talk with elected officials throughout the county, talking with you all, want to talk with folks in the business community about the economic development side of this, advocates in the community. So we see this as a starting point for a really broad conversation.
It seems like a really, really valuable tool. I know, you know, I have been working with a community that is working on their comprehensive plan, and they heard about this, and I see some of the members are here just to try to get some of the information and strategies. And I think that working with municipalities going forward, this will be really, really important information on kind of directing how communities try to strategize to accommodate the crisis of not enough affordable housing.
Yeah.
So we have a question from Kathy Nolan, and her question is, how does the growth of online short-term rentals impact the availability of potential sites for rental or residential housing?
Yeah, that's something we take a look at in the study, and we don't have real solid data on this, but we know that as housing moves into short-term rentals, it's not available then for long-term rental or for owner-occupied. And so that's one of the strategies that we recommend that municipalities take a look at, is how do they register and regulate short-term rentals within their municipality, and some municipalities have taken some steps to regulate both the process for short-term rentals and also the number of short-term rentals in their communities.
And we have another question from Vin Martello, just saying most of the development activity is very high-end, 1 million plus homes. Is there a thought to offering multi-year property tax breaks for developing median price homes, similar to the pilot incentives offered to commercial developers?
Yeah, that's a good question. I mean, there certainly are pilot incentives and different taxing strategies for developments that include a minimum share of affordable housing or you know, income-based housing, rent-controlled properties. But in terms of medium-priced homes, that's a good question. I know the IDA right now has a policy around supporting housing development, but I don't know what they may be looking at in terms of how that might change going forward.
Okay. Does anyone have any other questions? Oh, we have one more from Kathy Nolan. Has Ulster County looked at developing models for opening up zoning codes to allow multiple tiny houses on one site?
I'd like to ask Dennis Doyle to answer that question if I could. I know we certainly have talked with some folks who are looking at tiny houses as an emergency housing strategy, and my understanding from talking with Dennis is there's not a zoning issue around tiny houses per se. There you go. That's Dennis's answer, is that please contact the county planning department for assistance with this. But I'll say, you know, my understanding from Dennis is that the issue is not with tiny per se, but with all of the other aspects in terms of form and water supply and all of these other issues. But yeah, Dennis can certainly answer your questions in great detail about that.
Any other questions from our participants? Well, thank you so much. I think that the work that you're doing is fantastic and obviously very much in need and will help really inform communities and developers. So we really appreciate you sharing that with us today. And we'd love to have you back again to talk about it sometime during the year.
Great, thanks. Glad to be here with you.
Thank you so much. So I'm going to share my screen again and bring up where we're at. There we go. So let me just move our presentation ahead. I want to take the time to introduce our next speaker, Vin Martello. Many of you know, the Director of Community Health Relations at the Ulster County Department of Health and Mental Health. He's also the Director of the Opioid Prevention Strategy for the Ulster County Executive's Office. We'll be sharing with us today on the opioid epidemic and response. So I'd just like to welcome Vin. Whoops. I need to go back. That was a little too much. There we go. Okay.
Hi, everyone. I'm going to share my screen. Hopefully this will work well. Host disabled participant screen sharing.
Let's see if I can find you here, and we'll make sure that you are absolutely shared, can share. Then.
I think you should be able to do it now. I changed something. So
Okay.
Okay, thank you.
Very good. Okay.
There you
here we
go. Thanks, Katie.
Thank you, Katie. And forgive me if this PowerPoint doesn't have a lot of the beautiful graphics and bells and whistles of previous ones. I've been also very immersed in the COVID vaccination scenario. So anyway, so let me get it started here, and there we go. Move off to the first slide. So I wanted to start off with a data snapshot, because I think it's important to provide everybody with some context. Some of you have been at our multiple coalition meetings over the years, so you're very aware of these statistics. Others haven't, but this will give you kind of an idea of where we were at. So in 2018, Ulster County had the second highest rate of opioid-related fatalities in New York State out of all 62 counties. We had a total of 233 overdoses. 56% of those overdoses were fatal, and 24.1% of all of the overdoses were fatal. So almost 1/4 of the total overdoses were fatal in 2018, which really accounts for that big number. So during this period of time is when we started our very first coalition. I had gone to Dr. Smith and the county executive at the time and said, look, this is really not acceptable. You know, I sit across from the hall from the medical examiner investigator, death scene investigator, and she would come into my office like every day, you know, we lost another one. So I was seeing this information in real time. So I went to the commissioner and the county executive and said, look, you know, whatever we've been doing, we have to really seriously rethink this scenario and really take a deep dive and and really investigate what's going on. So when we put that together, that coalition, which consisted of around 60 community partners from every sector, we did a couple of things. We looked at best and promising and evidence-based practices around the country. We researched 26 different task force reports from different states and municipalities. And we also closely examined all of the entire process system of treatment, care, and recovery in and around Ulster County to see what was working and what wasn't working, kind of a SWOT analysis in that sense. And we came up with a couple of different conclusions. One big conclusion was that, we had a lot of great organizations doing great work, but the system was very, very, very fragmented, and that, people were overdosing all over Ulster County, and sometimes they would make it to a program, sometimes they would make it to emergency department, sometimes they would get linked to a peer, but we had no way of knowing. We did not know what happened to those people next. In fact, we couldn't even answer the question. So we really looked at how we could better connect the dots and integrate those systems to make that work, and then also introduce things that we had learned outside of Ulster County that other communities were working on that had proved to be really successful. So as that coalition got started, we got to 2019 and we started implementing some of those things. We put a medication-assisted treatment program in the jail. We got medication-assisted treatment in the emergency departments at Mellonville Hospital. When I say we, I mean we, the community, not the Department of Health and not Ulster County by itself. This is very much a community effort. We put MAT programs in the Kingston and Ellenville hospitals. We really ramped up the distribution of Narcan, which can immediately affect the reverse an overdose, hopefully, and a number of other programs. But at that point in 2019, we had very few resources. We had no staff, full-time staff on it. It was really just a lot of people with goodwill and organizations working together to try to improve things. From this point on, we started securing huge grants, over $4 million in grants from the CDC, from the Bureau of Justice Assistance, from then the Columbia University Healing Community Studies Project came into effect. And we actually reduced our opioid fatalities by 41% in 2019, which was really amazing. We had more overall overdoses, right? But this is the big number here, this 12.3. We reduced the number of overdoses that were fatal by half. And because of all of the harm reduction measures that we had put into place, we really kept the people that were overdosing, a lot more of them, from dying. And that accounted for this number. And then 2020 hit. Drove those numbers way up, number of overdoses. So far, the number we have for 2020 is 55, but there are probably about 8 more pending that are awaiting toxicology reports. But this number is really significant because we even drove the percentage that were fatal differently. I mean, down a little bit. So the point being is that if we had this percentage here, this number would be well over 100. Our harm reduction, and as I'll show on the next slide, was working. You can see this is just a graphical representation of this. And you can see that even though in 20, even though the overdoses were higher, the percentages were pretty consistent, were lower. But what happened when COVID hit? Okay, so we had twice as many overdoses than our worst year on record in 2018. And COVID did a number of things. One is that it forced people into isolation. Isolation is not the friend of substance use addiction. People had health concerns. They had emotional health issues. They had financial concerns. Some of the things that Evelyn talked about with housing. And the other thing was that the traditional drug supply chain distribution was broken. So that heroin corridor coming up from New York City was severed to a great extent. And the local dealers began to, since fentanyl is primarily available through the mails, and even though the post office tries to interdict that, as my friend in the high intensity drug trafficking area team said, she said, if I were to take you down to JFK, millions of packages come into their system from overseas every day, and they have dogs, sniffing out drugs and explosive, those kinds of things. But the dogs are just overwhelmed. And so a lot of, so a typical fentanyl distributor will send, if they send 100 packages and 90 get intercepted, that still leaves 10 that get through. And that's profitable enough to make it. So local drug dealers started mixing much more deadly fentanyl into their system. But as I said, the percentage of the overdoses in 2020 was less than half of that of 2018, which says that our harm reduction strategies are working. So I'd like to just review what some of those strategies are. So we greatly expanded training and virtual training in the use of Narcan, and we had a lot of community organizations doing this. Mellonville, even the National Guard got involved, grassroots organizations of every kind, making training available, even delivering Narcan, doing pop-up trainings in overdose hotspots. We installed nalox boxes in public buildings throughout Ulster County. These are basically similar to the automatic electronic defibrillator boxes, except they have Narcan and instructions for use. And using Narcan is really easy these days. It's like a saline spray that you would buy, like, at a pharmacy. And it's really easy to administer. And as I said, enhanced distribution of delivery of Narcan, including to overdose hotspots everywhere that we could think of. Then we vastly increased the number of providers that were waived and willing to prescribe medication for opioid use disorder. In order for providers to prescribe buprenorphine, which really reduces cravings dramatically and allows the person to lead a pretty much normally functioning life while reducing the craving, they have to get a special waiver from the DEA to do that. So we greatly expanded the number of treatment providers that were not only waived, but willing to actually prescribe. And what really changed that equation was that OASIS waived in-person visits for prescribing and what happened was that originally you had to do your first visit in person because the provider had to go, meet you in person before they would be willing to prescribe medications for opioid use disorder. But telemedicine greatly expanded this number of providers. We launched and expanded a medication-assisted treatment program in the Ulster County Jail. At first, it was made available to only individuals who already came in who were already on a medication-assisted treatment program, to everyone for the asking, every single person. And we also had put in other supports and treatment options there. As I said, the emergency departments in Mellonville and Kingston were actively making buprenorphine available, OASIS waiving in-person visits. And then we launched communications programs in conjunction with our healing community studies to destigmatize medication for opioid use disorder and to emphasize that opioid use disorder is a chronic disease like diabetes, like heart disease, like any other disease, and it deserves to be treated as such with dignity and respect and compassion. And a lot of the, when we put the medication-assisted program in the jail, when we first began to discuss that with, the corrections team and others in the law enforcement community, the biggest drawback was, or the biggest objection was, well, you're just prescribing one drug for another. What's with that? And then I remember at a particular meeting, the woman who runs the medical program at Rikers Island said, well, you know, that's interesting because just this week, one of the correction officers collapsed to the ground with a massive heart attack. We revived him, and now he's going to have to take medications for the rest, 6 different medications for the rest of his life. Should we just tell him that it's not a good idea to take medications for the rest of your life? And even so, buprenorphine and medication is not designed to be a forever thing. It's designed to stabilize the person until you can work with that person to the point where they're really ready to change their lives and accept a commitment to sustainable recovery. And again, the other thing that we did was really increase connections to support for effective and compassionate treatment, care, and recovery. We funded Samadhi to train and employ certified peer recovery advocates, 22 plus scholarships a year that we fund through one of our grants. We increased grant funding to expand and support all kinds of harm reduction services, Hudson Valley Community Services and others. We are doing care and recovery coordination and overdose hotspots. Samadhi is even opening, like in certain housing projects where there have been a number of overdoses, to put an actual office in those places and really work with people. We are embedding care coordinators and mental health professionals right in our Ulster County Emergency 911 system. We are making available housing and childcare vouchers to assist individuals suffering from OUD. The problem is that people in, you know, the MAT program in the jail or other programs, they do well while they're in the program, and then they get out and they're sent back to the same environment where they got into trouble in the first place, where drug use is rampant and where the temptations are many, and back they go. And then the last one is something that we that was really a unique idea. As we looked over the whole system of treatment, care, and recovery, and as I said before, the system was very fragmented, and we didn't really know what happened to people who were at high risk as defined by recurring overdoses. What happened to them? Did they, you know, if they fell off everyone's radar screen and didn't get noticed, what happened? And, you know, sooner or later their luck ran out, they overdosed again, and this time they died, whatever. So we decided that we wanted to create something, and we worked on this together with Mellonville and others, high-risk mitigation teams. What is a high-risk mitigation team? High-risk mitigation team consists of case managers, care managers, peer advocates, support staff, social workers, and individuals can get referred to the high-risk mitigation team where through a hotline, by a call in by the public, discharged from the Ulster County Jail, from the hospital emergency departments, from the opioid courts, however they get there. Once they get there, the case managers, care managers work with that individual to create a safety and recovery plan that's designed to change over time. As you know, it's a living, breathing document that changes over time and gets adjusted. And so they set up a program. That program might consist of outpatient, some inpatient. It might consist of buprenorphine medication. It might consist of helping that individual with employment by bringing in other county resources like the Office of Employment Training, housing, all those things that are barriers to a person sticking with a treatment program and deciding that they want to move toward recovery. But it's made to follow the individual through the multi-year process of treatment, care, and recovery, because that's what it is. It's a multi-year process, and it's characterized by setbacks. It's almost like a given that it's not a straight line to successful recovery. It's a zigzag line. But the important thing is that one accountable team follows that individual and knows that if they drop off the radar screen, so for instance, if the peers can't get hold of that individual more than 2 consecutive times, an alert goes out to the response team that goes and finds that person. If they miss an appointment, all of the providers are linked in behind all of this is an integrated database system that we created that all of the providers in Ulster County and programs in and around Ulster County are linked into. So so-and-so is supposed to be at a treatment program appointment at 4 o'clock on Thursday and they don't show up, an alert goes back to the team and the team reaches out to that person and so on and so forth. And so this process goes through and then, hopefully it gets to the place of recovery. And so what we did is we created, in conjunction with Mellonville, we created a couple of teams to deal with most of Ulster County, but a dedicated team to high-risk mitigation team to work in Kingston, where 40% of the overdoses happen. And part of that, they're working under the auspices of the Sheriff's Department Oracle team, which is a team of people, officers who are plainclothes. They don't carry weapons. They are certified. They are CASACs. One is studying for his PhD in clinical psychology, and others. They are the reach out team so that they can respond to opioid overdose incidents and really get that person into the system. And then the care manager meets with them and then gets the individual's consent to be followed by this database system. And the way that's done is we say to the person, look, this information will not be shared with anybody. It will never be used for a law enforcement purpose. What we're here for and what this database system is here for is to catch you if and when you fall. We've got your back. And so now we have a highly accountable, highly integrated, data-backed system so that we now can answer that question, what happened to that person who overdosed and where are they at any point in this continuum? The other area we worked in was improving prescribing practices, because we know that the opioid epidemic was driven by opioid pain reliever prescribing. So we created a task force of providers and pharmacists to work together on effective ways to educate patients as to the risk of opioid-based pain relievers, encouraging the use and discussion of CDC prescribing guidelines, which encourages non-opioid alternatives. If opioids are prescribed, the lowest possible dose for the shortest period of time. And the big one is creating a customized pain management plan for every patient, not a one-size-fits-all. Here's your bottle of, Vicodin, a Percocet, Oxycontin, but a customized treatment plan that includes alternatives like physical therapy and yoga, acupuncture, whatever those things might be. And then also to educate patients to engage their providers in a dialogue. So because the patients are the customers, to take responsibility for their health and ask their providers, is there another way that we can handle this pain I'm having from this dislocated shoulder or from whatever it is? So that's what we're doing. And this is an early part. This is like a hand-drawn, but this was our early coalition was focused on 3 areas. It was improving treatment and recovery services. It was reducing supply through prescribing practices, medication take-back, law enforcement interdiction of drug trafficking, improving treatment and recovery services that I just explained. This is the drug pipeline where people get into the drug pipeline because of all of these adverse child experiences, generational poverty, all of those things. They get into the pipeline, and then, they get to the treatment and recovery. We've been doing a lot of work here. A lot of the funding has been improving in treatment and recovery processes, because if you don't, and you end up circulating back into the pipeline or maybe even dying. But we also recognize that you can reduce all of the supply you want, but if you don't reduce demand, you'll simply be treading water, that you have to keep young people from entering this pipeline. And if you're just working on the treatment and recovery part of the equation, it's almost like it's a good thing to do, but the horse is already out of the barn and now you're trying to close the barn door. Let's try to keep our young people from getting involved. So what are we doing there? We just got close to $1 million grant from NACCHO, and we will be working with school systems all over Ulster County, Ulster Prevention Council, Ryan, Raising Youth Awareness to Narcotics, Hope Rocks, Center for Creative Education, and a lot of other community partners. We are going to create a huge student-driven and comprehensive peer-to-peer messaging program, messaging campaign in all media, raising the awareness of the risks, dechlorifying substance use, promoting positive and pro-social alternatives to substance use. And then we also have a huge media buying budget. So after the students create all of the elements of the campaign in social media, TV, radio, billboards, whatever they're interested in doing, we are going to take a gigantic budget and we are going to run that campaign for 6 months everywhere in Ulster County. And I got commitments from Ulster Savings and the Ulster County Chamber of Commerce to help secure private sector financing, underwriting to continue to fuel that campaign long after the grant funding has expired. And there's so much more going on that we would be here for hours if I tried to explain it all to you. So I tried to highlight it, but we're making tremendous progress. I think that once COVID subsides, that I can't imagine any other community that is doing as much as we're doing and who is doing it as strategically as we're doing it, and with an amazing group of highly dedicated, passionate, committed people and organizations. And that's all I have on that.
Thank you, Vin. That was amazingly informative. And, you know, I participated on that committee, and just you've come so much further and done so much more in the response to the opioid epidemic. Anyone who has questions for Vin, please put them in the chat. I guess one of the questions I would have, Vin, is with this new project that you're going to be doing a lot of outreach and peer-to-peer messaging and things in the media, you know, are other agencies and organizations also going to be kind of mobilized to share these messages? And can we, as the Healthy Ulster Council, also perhaps get that out there on behalf of, you know, this project?
Absolutely, because a big part of this will be in the social media realm. So yes, we're going to be asking. So, you know, we're working on all media platforms. So what we're saying to the students is, you can work on whatever work group interests you. So if you're like more graphic, artistic oriented, and you want to do graphics or billboard designs, you can do that. If you want to do videos that can be used on social media for TV commercials, you can do that. If you want to do work on radio, you can do that. Whatever it is you want to do. Yes, in addition to all of the paid media, we're going to be asking all of our partners to push all of this out on their social media accounts and websites.
So that brings me just to remind everyone that we do have a Healthy Ulster Council Google group where we can share this information with you to then put out in your networks. So I will continue to add you to the Google groups, but if you are not a part of it, do email me and I'll make sure you are, so that the Healthy Ulster Council helps with this project. You do have a question, Vin, from Kathy Nolan. How do you expect the legalization of marijuana, if that happens this year, to affect the Nacho Grant project?
Well, you know, I know that there are some of our political leaders have varying views on this, but from a public health perspective, and maybe in Vin's opinion as part of Ulster Prevention Council, as we're a bit worried about the legalization of marijuana, because we think that there's a big difference between decriminalizing and legalizing, and the difference is the power of marketing, right? Because you could say, all right, we're not going to go out and arrest people for small amounts of marijuana. In fact, they don't do that now if you're using it in your home. But if you're using it on the street, it could be a misdemeanor arrest, right? So that law has also been changed subsequently. So, but the difference is, once you fully legalize it, then you bring in the power of marketing and advertising, right? So do I want my 15-year-old daughter to be hawked all day by advertising touting the virtues of getting hot, and not really. And and the marijuana companies say, no, we're not doing that. And it's the same thing that tobacco companies say. We don't market our products to kids. And yet when they did the tobacco settlements in 1998 and they got all the memos and documentation, they were talking about recruiting new smokers. Well, that's a code word for marketing to youth. And it wasn't, and they have to recruit new smokers because their customers are literally dying at the higher end of the spectrum. So, to me, it's like, and this is again all in personal opinion, that okay, you say you don't market to kids, then why do you have lollipops and gummy bears with THC? It's like, come on. If there's millions or billions of dollars to be made and tax revenues to be generated, it's hard to stop that train. And so we worry about that. And
I also wanted to share that, thank you, because I think that's a really great answer to Kathy's question. Sophia Skacha also said that, just wanted to make a comment that was very impressive, that despite the increase to 462 overdoses, that only 11.9% fatality, which was lower than 2019 and 2018. Just excellent work by your team. And Tom and Carrie said, well said, Vin. A lot of people are in agreement with what you just shared. Any other questions? I'm just keeping my eye on the schedule. Any other questions for Vin? It was a really great presentation.
Thank you. Appreciate that.
Okay, so we are going to move on to the next part of our, and look, Kathy's showing you all what you can do down below. You can put thumbs up, clapping, there's a lot of tools to silently give your applause in Zoom. So I want to move on into the next part of our program. As you know, the Healthy Ulster Council gets together bi-monthly for professional development and for networking and for collective action. We were just talking about some of the ways that we can help promote, the messaging that Vin's team is going to be putting out for the opioid crisis, but there are other projects that we take on. One of the things that we do at our meetings is we model healthy behavior. If we were in person, you would be offered a healthy snack to model healthy meeting behavior. And if you were in person and even on Zoom, we still continue to have a movement break, which is so important to what we do. Today, I did have scheduled for all of you on YouTube, office yoga, which I think we're still going to do in March, but we're basically going to just put that off because there's an elephant in the room here today. And that's, of course, that this week, the distribution of the vaccine for COVID-19 has begun in Ulster County, and we wanted to give the health department a chance to just give us a brief update on that, just because I'm sure everybody's very interested in that. So what I would like you to do while you're listening to this update is just, turn your camera off for a minute, stand up and stretch on your own. And I'm going to give Stacy the floor just to give us that share of what's going on with the vaccine rollout. So Stacy, remember, you got to stretch.
Oh yeah, thank you, Melinda, for that. So this update is based on my latest guidance, and due to the ever-evolving nature of corona pandemic, the information is subject to change by the minute. So, I look at the governor's updates as much as I can, and we should all be trying to tune into our county executive's updates because he is really the expert at knowing what's, the latest. So we did, and to know when he presents is so important because you can share that with your clients, and that is every Tuesday and Thursday at 3 p.m. The time did change, and you find him on his social media Facebook page, and then it gets archived into the county's COVID website. So it'll be on the front page of that website after the recording. So someone that doesn't feel comfortable on the social media site can see it afterwards. And as far as what the governor said yesterday, you know, New York administered 732,066 vaccine doses. And, you know, the county is currently following New York State's criteria for eligibility. So we are in phase 1A and 1B. And just this week, the governor expanded the eligibility to 1B, which now includes ages 65 and older. So we're seeing a bigger set of people who are eligible, and this is problematic because we still don't have enough vaccine to get through the 1A category. So you can imagine with our population of 180K, the 65 and up is about 36K residents, or about 20% of our population. So a quarter of our population is eligible, but not nearly enough supply is available in Ulster County right now. So we want to be upfront and transparent about the situation, and we're unhappy about it. And the county executive is putting pressure on the federal government to, you know, try to speed things up. And so, you know, that is very challenging. But all of this information is being shared and is available on the website, which is our COVID county website. And you go to the vaccine tab, and there is some great frequently asked questions. So I encourage you all to get there and fill out the notify me bubble. It's red on the left-hand side, and you can also be updated when our pod locations have appointments. But right now, there's no appointments to be had because of the supply and demand issue with the vaccine. So that's what I know. We are doing super fabulous with our pod sites, though. These have been an amazing collaborative with so many wonderful volunteers, doctors, nurses, you know, non-medical patient flow people who have committed themselves to helping us to make this a success. So these sites are, the Kingston site is running, and the Mellonville site was scheduled to open. And so, you know, things are working well in our organization of getting it out there. But like I said, we just have to be patient with as soon as the supply becomes available, they're going to release more to us, and we're going to be ready to roll that out. So we're situated to run our site 7 days a week, 24 hours a day, with, you know, commitment to getting this done. That's what the county executive said. But, you know, our hours of operation at the Kingston site are about 8 to 6 p.m. And he said on Tuesday that we were able to do just shy of 500 vaccines per day. That's going to change in his update today, I'm sure. And so we have over 14,000 people signed up on our vaccinatorulster.com site. And we're going to be sending out those regular updates. So get signed up, please. And when you're eligible, then you can make your appointment. Ben, do you have anything further to add on this?
No, I mean, I think, you know, the real constraint is in supply. You know, when they lowered the age to 65, that made 7 million New Yorkers eligible, and we only have 300,000 doses per week at best in all of New York State. So on top of that, the vaccination distribution is very sporadic. So I've been at the pod a few days when they were down to 20 doses and didn't know whether there was any coming tomorrow or the next day. And then all of a sudden, out of the blue, 800 doses would appear from somewhere, you know, and makes it very hard to plan, to schedule volunteers and appointments when you don't know what the supply is going to be on any given day. So yes, we are asking people to be patient. You know, it's really disconcerting to people to not have a definite appointment set up, but we can't make appointments, which is essentially a promise to provide something that we can't deliver on, necessarily.
Thank you. Thank you so much for the update. I think that just hearing that from the health department is very important, and sharing more information as much as we can. Stacy, perhaps you could put the link to the website in the chat, and then people can be sure that they sign up for more information. I'm going to move us quickly into the final section of our meeting, simply because we're getting there. We're got about 20 minutes left, and I want to be sure that we have a chance to get to networking, because that's a very important part of our meeting. So this is the part of the meeting where this is sort of a facilitated discussion where you will get to turn back your speaker on. You briefly share your organization's name and your name and upcoming program or event. We do have 30 people here today still in the meeting that would like to share. So I'm going to call upon you, state the name, your name and your organization's name, briefly share an upcoming event or program. If you have more details that you want to share, put it in the chat, because you basically, in order to give everyone a turn, we're going to make it very, very quick. And focus on that event or program rather than your overall organization. Remember that you can also share details such as your website and more information in that chat. So keep it short and sweet. Whoops, I'm going to go back. I didn't go back. Yikes. I went off instead. I'll fix that in a minute. I want to get everybody there. So let's go ahead and start sharing. I'm just going to go across the way I see it. Gabrielle. You just have to unmute to talk. So if Gabrielle would like to share.
Hi, how are you? My name is Gabrielle. I'm with People USA. And one of the upcoming things and things that we work on is we do Zoom groups here in Kingston. We Zoom out. And my partner here, Eric, does DRT, DTR, I apologize. And he could tell you more about that, but that's double trouble in recovery. So it deals with dual diagnoses at a 12-step program. And I'm doing Zoom groups just to get people together to chat, do crafts, and feel better about themselves one-on-one, whether it's cooking, yoga, so forth and so on.
Awesome. If you have more information, again, you can share that in the chat, how to reach out to you.
Great,
Tom
thanks.
McCary.
Hi, this is Tom from the Institute for Family Health. Thank you so much for organizing this meeting this afternoon. Very informative and great to hear all of the awesome things going on. I know that the Institute is involved in a lot of what was discussed today, including the partnership with the local hospitals around and Ulster County Jail and access to buprenorphine. I just got a message today from our substance use disorder care navigators that we had 2 recent referrals from Mellonville Hospital to help initiate people into buprenorphine, and we're able to get them appointments promptly. So, you know, things are going really well. We're doing our best to get all of the staff vaccinated. Started about a week after, you know, the very initial vaccinations in the whole country. So I've been really, really impressed with that, and you know, continue to support our staff up here in Ulster County, Dutchess County, and the city in doing the really challenging work and supporting, you know, the most vulnerable people. So
Thank you, Tom.
Yeah.
Kathy Nolan.
Thank you very much. I think you know, Vin's presentation dealt with a lot of what Samadhi is doing, and the only thing I would mention, it's not an upcoming event, but we did do a memorial service for people that had been working with Samadhi who were lost during the past year. And it turned out that was very powerful for a lot of people, and probably something that we will be doing going forward. So just share it as kind of an innovation to make sure that staff and family and friends all have a way to come together, either safely distanced or remotely, to deal with the losses that we have had. All of Samadhi's programs are open, both in person and online. And so if anybody knows people who need the services, or if you want to get involved as a volunteer, just get in touch.
Thank you, Kathy. Ruth Stratton.
Thanks.
Hi, can you hear me?
I can.
Okay, I'm Ruth Stratton from Fidelis Care. We offer quality, affordable health coverage for children and adults. We do that through offering Child Health Plus, Medicaid managed care, the Essential Plan, and qualified health plans. If you know anyone in need of insurance, please give me a call. My information is in the chat box. Thank you.
Thank you,
Be
Ruth.
safe.
Let's see, Katie Sheehan.
Hi, so my name is Katie Sheehan Lopez. I am the SNAP-Ed nutrition educator at Cornell Cooperative Extension of Ulster County. So I have virtual nutrition education that I can do for pretty much any age group, and that includes classrooms if you know any teachers that might be interested. So I will put my name and email into the chat box. So if anyone has a group that they think would be interested, however small or large it is, please let me know.
Thank you. Leanne Thornton.
Hi. Thank you for extending the invitation to participate in this program this afternoon. I'm on the Saugerties Town Board and very involved with our comprehensive plan update for the town and village of Saugerties, and specifically Melinda's presentation on the task force, and rather Evelyn's presentation with regard to housing and housing needs in Ulster County is something that we are definitely, it's a challenge to how you present this in a community where in the village of Saugerties there's very little housing potential for rebuilding. There's nothing there. So I was very interested to see what the county's recommendations are, and we'll bring that back to the community. Also, the presentation on the drug task force, one of the things that might also help to get the word out there is using public access stations here in Ulster County. I mean, we have Lighthouse TV in Saugerties. So if the school groups or any organization has messages that they want to get out for activities, I would encourage people to reach out to Lighthouse TV 23 in Saugerties and any other public access stations that are functioning right now in Ulster County.
Thank you, Leanne.
Thank you.
Madison Freeman.
Hi, can you hear me?
Yeah.
Awesome. I'm the new population health coordinator at Mellonville Regional Rural Health Network. So I've met some of you, but not the majority of you. So nice to virtually meet all of you. And thank you for inviting me. Upcoming event we are actually pairing with Katie from Cornell on Monday for our teen life skills event for teenagers, led by our community health worker. We also have some additional upcoming events for adults and seniors. So if you would like any additional information, I will put my information in the chat.
Awesome. Thank you. And feel free when it's your turn to share, you put your video on if you like. So if that makes you comfortable. It's always good to put a face to a name. Gloria Waslin. Gloria, can you unmute? I'm going to give her a chance to do that. I'm going to move on to Greg Howard.
Good afternoon, everyone. I'm Greg Howard, the Executive Director of Community Action. And of course, events have been very slight during the COVID stuff, but what we've been working on is trying to make sure food is getting to people And so our farm stands start back up in February, and our mass food distributions hopefully will start in April. Of course, in February, it's barring weather in both Ulster and Sullivan counties. We've gone back into homes to do weatherization and helping people that way. And of course, we're always looking for more applications for the Head Start and Early Head Start program of Ulster County as well.
Thank you, Greg. Donna Greenfield.
Donna put a message in the chat that she couldn't connect by audio, but she put a message. Do you want me to read the message?
Yeah, that'd be great, Kathy. Go ahead.
From Donna Greenfield, Ulster County Department of Health. I have no microphone. Blood lead levels for kids have increased since COVID because people are spending more time at home. Please let your clients know that some best practices are wash kids' hands before eating and sleeping and when they come in from outside. Wet cleaning once or twice a week with a Swiffer or mop is important because vacuuming or sweeping can spread lead dust if there is deteriorated lead paint in the house. And foods high in vitamin C, iron, and calcium can reduce lead absorption.
Thank you so much for sharing that, Donna. Cameron Coleman.
Hi, how are you? Thank you so much for the opportunity to join this meeting today. Can you hear me okay?
I can. What organization, Cameron?
Great. I'm here from Hudson Valley Community Services. I am a program supervisor. I'm based in Kingston, and the programs I cover here in Ulster are our harm reduction services program, and also very excited to announce our new street outreach program, which was made possible through the outreach-centered response to the opioid overdoses that Vin spoke about earlier. So we're thrilled to get that up and going, and through that, we'll be able to provide in-person and virtual Narcan training, provide harm reduction supplies, low threshold counseling surrounding active substance use, as well as referrals and linkages to both MAT and abstinence-based treatment. So for any inquiries or referrals about that, please feel free to reach out to me. I'll go ahead and include my information and email in the chat.
Awesome. Thanks so much, Cameron. John Vale.
Hey there, everyone. I think I know quite a few folks here. I'm John Vale from the American Red Cross. Actually, instead of having myself introduced, I'm going to have, we have two Disaster Resiliency Corps AmeriCorps members here today that are going to give an update on our preparedness program. So Holly, Orville, I don't know if you guys want to maybe just quickly take a program yourselves and share some good information with everyone here. Thanks.
Afternoon, everyone. Yeah, how do you go? Sorry.
All right, sorry about that. Yeah, so what we're looking for is, I'm Holly, by the way. What we're looking for is groups that are youth groups, community groups, any groups that want to partner with us for our preparedness. We're doing emergency preparedness, so we're focusing on. We have two small programs for the youth. We have Prepare with Pedro and Pillowcase, and I'm going to talk about CPC because that's my favorite. And that one is for high schoolers and older adults. It teaches you the very basics of what to do in an emergency, how to prepare, respond, and recover from an emergency, and what materials you might need. I'm going to hand it off to Orville.
Thank you, Holly, and thank you, John. So our two smaller programs that Holly was talking about were called Prepare with Pedro and the Pillowcase Project. So both of these emergency preparedness programs are more geared towards younger audiences, so elementary and middle school students. What's awesome about these programs is that students are really engaged with them, and the idea is to engage with the students and make sure that they understand the material. And Holly and I were able to present to Fishkill Plains Elementary in Dutchess County, which was pretty awesome. And we got some really good feedback from the teachers and some praise from a former teacher as well.
Thank you, Orville. Did Dakota Monica go? Things shifted around in my screen. People came and went.
I did not. Thank you, Melinda.
Okay.
I'm going to piggyback off of Greg Howard. My name's Dakota. I work as the health assistant for the early and Head Start programs in Ulster County. We service areas like Ellenville, Platic Hills, Saugerties, and Kingston currently for income eligible families that have little ones that are interested in childcare. 0 to 5. One interesting thing that I did want to share with everyone, and I'll put the link for the email as well as the contact information as well. As we know, COVID seems to be a stressor, especially even in childcare facilities and families' comfort levels in regards to sending their children. We are getting a program up and running for virtual learning for little ones. So if you guys know of anybody that have little ones that would still like to participate in school activities, like I said, I'll put that information into the chat box for you guys. But we're also looking for anybody that would want to be a teacher's assistant, teacher's aide, lead teachers. We're always hiring, so send them our way too.
Fabulous. Signe Furia.
Hello, can you hear me?
Yes.
Okay, great. Hi, I'm Signe Furia, and I'm the director of the Wellbeing Institute at the Hudson Valley LGBTQ+ Community Center. And thanks so much for both of those fantastic presentations. To keep it brief, I just wanted to let everyone know that as of yesterday, the center has a new executive director that we're very excited about, Peter Criswell, who many of you may know from being a county legislator and sitting on the Kingston Arts Commission. So Peter started yesterday. We're excited about that. And then just wanted to update you on the counseling program at the center, which we are doing completely virtually, offering short-term counseling for individual couples and families, as well as groups, virtual yoga, just relaunching the Teen Leadership Council, and our website is lgbtqcenter.org, where you can check for updates. In February, we're going to have a fantastic Black History Month film series and discussions, as well as an inauguration, a post-inauguration letter writing party. So again, lgbtqcenter.org, and the counseling, you can email counseling@lgbtqcenter.org.
Feel free to put that kind of information in the chat, just so
Okay.
we do save a little time.
Okay.
Christine Noble.
Hello, everybody. Sorry, I wasn't sure if you saw me, Melinda. I can't get the video on my home laptop for some reason.
Okay.
At any rate, our office is doing a lot of online presentations for seniors. I know next week, today we had one, so it's too late to announce that, but next week we're having one on making pumpkin soup by our dietitian nutritionist. And so you can go on our website and see which ones are coming up for each month. A lot of them are stolen from our Live, Laugh, and Learn program, which we had to cancel now. At any rate, right now we're kind of busy helping seniors register for their COVID appointments. I know Sue and Pat Bryan just were on Channel 6 News today announcing it. So we're getting so many calls in our office about the COVID appointments, and a lot of seniors don't have computers to register. So we are helping with that right now if their family can't help. So that's basically all I wanted to say. All right.
Thank you.
Thank
Victoria
you.
Reed.
From Mellonville Regional Hospital. I won't go into a ton of stuff because Madison already covered some. I'll just add that we do have a brief after substance passing GRASP group that we run. I can post the dates in the chat, and it's also on our Facebook. And that's for people who've lost a loved one to substance use. And we know it's been a lot higher over the past year and coming into this year. So that's it.
Great. Thank you, Victoria. Sophia Scotcha.
Hi, good afternoon, everybody. So happy to be here, and thank you for having the meeting. And there was excellent presentations earlier. I'm Sophia Shaka with Hudson Valley Hospice, and Hudson Valley Hospice has continued to serve our community throughout this time period of COVID. We are serving individuals who have COVID, and just want to get that message out because I know I've been asked by a few people, are you still helping people even if they are, have COVID? And the answer is yes. So we are still going into homes. We are still going into the hospital and nursing homes, wherever an individual and their family are. That is where we are to help those who are at the end of life time frame, and to help them during that time. Also, want to just share that Hudson Valley Hospice has grown and has expanded such that in addition to our hospice care, we also have our palliative area that has grown. And, I can get information to people on that, but that is for individuals who maybe are not ready or qualify for hospice care, which is end of life care, but still, do need, help for the illnesses that they have. Also want to share that we have coming up another grief and support group that will be starting in February. We had them run during the holiday time frame, and due to their success, we've been asked to run them again. So we have another group support session that will be starting up in February. It is a virtual group. All are welcome, and that is yet another area that we do provide services to the community. So I'll leave my information online on the chat if anybody has questions. And thank you everybody for being here today. And it's just been wonderful learning about how we all can help each other. So
Thank
stay
you.
safe.
Thanks, Sophia. I realize we're at 3:30, but we have 3 people left. So I just want to give them their opportunity. If everyone could just hang on a little bit. So we have Jody Brunetto.
Good afternoon. Thank you so much for today. My name is Jody Brunetto. I am the Ulster County Peer Advocate, Certified Peer Advocate, and we are currently still serving peers in the community that are in crisis, whether they are in a point of hospitalization or in the community. So I will leave my information in the box if there's anybody that you would like to refer to People USA for peer support services, whether they're in crisis or just need additional support. We are available to service the community. Thank you, and thank you for the presentation.
Thank you. Sharon? Sharon, you would have to unmute. I'm going to move on to Eric Van Gaasbeck and give Sharon a minute.
Hello, everyone. My name is Eric Van Gaasbeck. I'm an Ulster County recovery specialist with People USA. My partner, Gabrielle Martinez, was on earlier, and I will try to keep this brief. In Recovery Center, we deal with people in the community who are struggling, who are in crisis, but also working on short-term goals. Anything from physical health to social and community engagement, healthcare engagement. The list goes on. We have a menu of services. Like to get that in the chat at all possible, in the near future. But I did put my information into the chat about my Zoom group that I am currently facilitating. It's one of a kind. There's not a lot of groups out there like it, dealing with mental diagnoses, mental challenges, mental wellness, along with substance abuse disorders. How they but they definitely play together. And we've been experiencing more people who didn't have, say, depression issues, very new mental illness afflictions that were not present with individuals before. So it's definitely tough times. We're doing our best. We're hanging in there. And I wanted to thank everybody, especially the presenters, for all the great information. Some staggering information, honestly. But I will wrap it up. Thanks again, everybody. I appreciate it. Take care. Stay safe.
Thank you very, very much. So I just wanted to close the meeting out and share with you all that a meeting evaluation form will be sent to you immediately following the meeting. This is really important to us as we move forward with Zoom meetings. It's been challenging to figure out how to get an evaluation through Zoom meetings, so this will be our best attempt. Our next Healthy Ulster Council meeting will be held Thursday, March 11th, 2021 from 2 o'clock to 3:30 p.m. You can visit healthyulstercounty.org for more information and for the meeting minutes. If you want more information about anything that was said at this meeting, both the Zoom will appear there. That takes a little longer, but the meeting minutes will be there much more quickly. And finally, I just want to be able to, whoops, somehow it all disappeared. Gotta love that. Anyway, I was just going to share our contact information for Stacy Kraft, myself, and just let you know that we look forward to seeing you at the next meeting. And be safe and be well. Thank you so much for attending.
Thank you.
Thank you, Melinda. Thank you, everybody.
Yes,
Thank you, everyone. Bye.
Linda, thanks everybody. Stay safe.
Have a
Take care.
great
Bye-bye now.
day.
Thank you. Bye.